Casey Goring, Chief Health Plan of Barbados.
Thank you very much. Okay, so we move on to item number 5. This meeting is scheduled to take about two and a half hours. We would like to ask you to keep your microphones turned off. When you need to ask a question, kindly use the icon to raise your hand for questions. Okay, so we can now proceed on to the item number 6, which is update on the current activities of HRH Commission. And the first item is the sensitization of achievements of the HRH Action Task Force / Commission, which will be presented by the Pan American Health Organization. Kindly proceed.
Thank you very much, Madam Chair. As you all know, we have been pushing to get a systematization of the work of the HRH Action Task Force first, and now the HRH Caribbean Commission, so we can have documented all the different achievements and also those challenges that in the moment the HRH Action Task Force faced, and now the Commission. So we had a consultant who started preparing some instruments to share with delegates and other key informants. But we had to stop this consultancy due to circumstances out of our control. We managed to get approved the tool that's going to be used. It's a short questionnaire that will be distributed to key stakeholders, in which we want to find out what's their views on achievements, challenges, opportunities, strengths of the first task force during the COVID-19 pandemic, and now the Commission. And most important, to look into the future, how we see the future of the Commission, what's going to be the possibilities of expanding and strengthening HRH in the Caribbean with support from the HRH Commission. What's going to be their role, and those questions that put us into the future and let us think about the future as a Commission. So I think the participation of everyone is very important, and soon you will be getting this tool. It's not a long one. Close the questions as much as we can. And also this consultant will continue collecting reports, agendas, minutes from meetings, and those documents that have been produced by the task force first, the Commission, or through consultancies from PAHO for the Commission. So that's what I have to report, Madam Chair. I don't know if there's any comment or question about it. Otherwise, I will give the floor to my colleague Cecilia Cunha to continue with the next sub-item of this agenda. So yes, over to you.
Thank you very much, Dr. Puertas. I just have one intervention with regards to the advancement of the HRH Commission. I would like to request if the Secretariat would be able to send to the member states a letter requesting for them to confirm their member who will represent them on the HRH Commission, because we do know that sometimes we do not have representation from some of our member states. So we would like if the Secretariat could send a reminder to member states, in particularly those who are not at the meetings for the last 3 HRH Commission meeting. So for those who have representation, we probably don't need to, but for those who do not, if the Secretariat could kindly send a letter to member states requesting their nomination. Thank you.
Thank you very much. Madam Chair, and I think that's a very important initiative. I think we have a hand raised.
Yes, Ms. Bender.
Hi, Chair. Just to mention that, yes, I know we've been having that challenge in the past. And what we have been doing is, as you recommended, calling the countries who we know have not been having consistent representation. And I'm glad to say that we're seeing some improvement. However, we haven't received some feedback from some member states as yet, but we intend to continue to try, and we'll keep you appraised of the progress we're making.
Thank you, Ms. Bender. So we can proceed to the policy brief on mobility of health workers.
Thank you. We would like to share a very brief presentation on the progress that we are making in that consultancy. Please confirm that you are viewing my screen.
Yes, we can view the screen.
Thank you.
You can put it in, yes, thank you.
Yes, thank you. So here we have in green what the progress we have made so far, in yellow the activities that are being carried out this week, and in red the activities that are pending. So the problem definition, data and literature review, stakeholder analysis, all these activities have already been developed. We are in the process of collecting information from stakeholders. So during the stakeholder consultation process, we sent semi-structured questionnaires and interviews to all members of the HRH Caribbean Commission and to other stakeholders. We are still waiting for some of the stakeholders to answer the questionnaire. And after we get all the information, we will proceed in the analysis of the stakeholders' inputs, drafting the report, and asking them for review and feedback from all of you. Regarding the stakeholders analysis and consultation, we identified 30 stakeholders. We did an assessment to identify which of the stakeholders were primary, secondary, and tertiary. 25 questionnaires were sent on the 12th of October. And we would like to thank Guyana, Grenada, Belize, Turks and Caicos, Dalhousie University, and some of our colleagues from WHO and from PAHO WHO for their answers. And we would like to remind the other stakeholders that this is a very good opportunity for you to express your views on this very important issue on migration of health workers in the Caribbean. So please complete the questionnaire and send it back to us. This is where we are now. We are waiting for all the stakeholders to complete the questionnaire. And we would like to ask you to please send us your questionnaires during this week, because we are running out of time to actually analyze all the information. I will stop sharing my presentation here, and this is the progress we have made so far. Thank you.
Madam Chair, if I may just add some additional remarks, and it's the fact that just to remind everyone that this is a mandate from COSOT Ministers of Health. This was the 29th COSOT in March 2023, when the Ministers of Health mandated, and I'm going to quote exactly the action, mandated the HRH Caribbean Commission with support from PAHO to develop a policy brief to address the mobility and migration of nurses and physicians, with policy actions to be implemented in the countries and territories of the Caribbean. So the date, again, it was March 2023, so I think we're a bit late to respond to this mandate from our Ministers of Health. So that's why we're trying to get the information by this week, so we can have the best information. And as we mentioned in our meeting in Chicago, many of the colleagues and CNOs were mentioning and talking about the importance of policy development, HRH policy development. So this is the opportunity of really having your inputs, your important inputs into this issue. I ask the support from the University of West Indies, University of Guyana, also to have the academic view on this situation. So we have high-level delegates from those institutions in the commission, and I will really ask them to provide their input through this questionnaire, so we can have a very good idea of what you think are the steps to take in the future and now to address this issue that we all know it's an important challenge for the Caribbean. So that would be just a reminder that this was a mandate from COSOT from March 2023, and we really would like to have something by the end of the year. Thank you very much, and over to you.
Yes, thank you very much, Dr. Puertas and Dr. Ancuna for the presentation, and definitely the issue of migration of healthcare workers and in particular nurses is a challenge for the Caribbean region, and it's only if we have the appropriate data for us to be able to make recommendations and informed decisions as to how we can address this particular issue regionally, but also from a national forefront as well. So we continue with the collaborative space for the HRH Commission. From PAHO, I am not sure who is going to do that presentation.
Sorry.
Please proceed, Ms. Fiona. Thank you.
Yes, good morning to everyone. We have not quite progressed on this area. I just wanted to bring it up as an idea that we could have some space on the virtual campus for public health where we're able to share and collaborate as part of the HRH Caribbean Commission. So it is still an idea that has not yet been fully realized. So I wanted to know if that would be something that we would want to do. The idea behind it is that similar to the classrooms that we have for the workshop that was in Panama, I was thinking that we could have a space where we're able to include all of the documents from the HRH Caribbean Commission and to be able to share ideas even outside of the meeting. So I just wanted some feedback from the group as to whether this is something that we would be interested in pursuing. Over.
Thank you, Ms. Fiona. I do think that it would be a good opportunity for us to have a platform where we can engage before the meeting. For example, it would help us with just an example with currently with the survey, we can have communication with each other, reminders, and it could also be used to share best practices and issues that others are facing and how they solve these HR issues. So I do think that it might have some benefits for us to have a space where we can collaborate as member states on the virtual campus, but that's just my view. We can hear from the other participants.
Just, sorry, Chair, just to interject. One concern would be whether people are actually going to engage with that platform, because we would not want to have a platform where nobody pays attention to it. So this is
Exactly.
why it's
important to have the views of others and their commitment. If they do think that this is an initiative that they would want to see the commission take on. Comments, the floor is open. You can also place your comments in the group chat if you do not want to speak. Are you having issues with your mic?
Okay, sorry, Chair. In the interest of time, I think maybe we can move to the next section. Perhaps we're not ready to discuss this as yet.
Okay.
And maybe
And
we can send out a vote.
yes, and we could probably have a little bit more details on the functions of this space and also the objective and what we would like to get out of having this collaborative space. So we could share some more details via email to the member states, and so we could get some feedback from the members. Thank you so much,
Thank you.
Miss Fiona. Okay, so we can move now to item 7. So report on the decisions of the 60th Directing Council and the presentation at the 45th COSAD. This is going to be done in partnership with the Secretariat and PAHO. Kindly proceed, Ms. Bender or Dr. Puertas. I am not sure who is going to do the presentation.
I suggest, since the COSOT meeting was the first one to occur during that time in September, if CARICOM could provide their report first, and then I will mention I will
On the
give the
Directing
report
Council.
on the Directing Council, which happened later.
Okay,
Thank
sure.
you.
Please
Thank you,
proceed,
Chair.
Ms. Bender. Thank you.
Thank you, Chair. So what we would report is that there was a COSAD, which was held in Washington, D.C. for health on the 22nd to the 23rd of September of this year. The HRH would have presented 3 papers as an informational items, as the format of the COSAD took a slightly different approach, where some items were not presented but rotated as informational papers, where member states would then be able to weigh in on what those items were. So there were 3 papers that were circulated in relation to the work the council has been doing, or the commission has been doing rather. One in relation to the WHO Catalytic Fund, and the other 2 in relation to the work related to the Human Resources for Health platform and what has been happening with the progress of the consultancy. So that information was provided beforehand and circulated. In addition to that, Dr. Puertas did make an intervention at the officials meeting, which was done prior. So what we do know for sure is that member states felt there needed to be more information provided on some of the work, and they would have identified HRH as a particularly sensitive point for which they were keenly interested in the work of this HRH and how it's progressing. So I believe moving forward, we would want to ensure that we make what is being done visible at the level of the COSAD. And if there are any particular items that require a decision from the COSAD, it would be very important that we make that clear, as the informational items were not tabled at the ministerial meeting. So if there was no decision to be made, it was not tabled, but it was tabled at the officials meeting. So perhaps we can look forward to looking at our priority areas, and if any of those areas require a decision from the COSAD before the next one arrives. Thank you. Over.
Thank you, Ms. Bender, for the update. Dr. Puertas, can you please proceed with the section on the 6th Directing Council? Thank you.
Thank you, Madam Chair. And if I may just comment on the COSOT meeting, I think it was important to see countries asking for those agenda items regarding HRH to be discussed, not just presented. And that was a very interesting moment, because there were only the documents that were provided, and that was it. But countries started asking why those issues or subjects are not going to be discussed. And that's why that's when the chair asked me to provide a brief on those different subjects and agenda items, which I did. So what I think is that countries see HRH as a priority, and that's why I think the importance of having this commission. And I also see that the commission could be also a platform to do advocacy. So those agenda items for next COSOT meetings or any other regional meeting is considered. And not because we want it, but that's because the countries are asking for it. And we see that happening everywhere. HRH now it's a global issue, and there's a crisis, as we see, a global crisis regarding shortages, migration, and we need to be able to show them, to discuss them in this type of events. So it was a bit probably uncomfortable for the chair, because countries started really asking, we need to discuss this. Why it's not discussed? So that's my call, that the commission and those entities that are represented here, we do some advocacy, so we have the space that the subject requires. I think that for next COSOT, something that we are going to have ready, and we will need a decision from ministers of health, will be the healthcare workers migration policy brief. So that's why I think it's important to work on that, because then it's something that they will see that needs to be addressed. We hear once and over again comments and criticism from ministers of health about not seeing much done in terms of addressing healthcare workers migration. So, well, this is something that we can present to those ministers of health, in which everybody is involved. So that would be my comment on that. So talking about the directing council, which happened the week after the COSOT meeting, we presented, as you all know, the policy on health workforce 2030. That I'm sure you're familiar with it. I will share the slide so you remember what the 5 strategic lines of the policy. And the interesting part was after presenting, which in this case I did the presentation of the policy on health workforce, strengthening human resources for health to achieve resilient health systems. There was a discussion, and every member state, most of them, they requested to comment about the policy. So that showed the interest of the countries in this area of human resources for health. We had about 26 countries commenting, including most of the Caribbean countries who were there with their official delegations. And I would say all the comments were positive about having this policy approved. There was one country, which was Mexico, that had some, that they were completely in agreement of having the policy approved. And they just had a comment on the resolution regarding regulation that later on it was solved. So when the question to countries to approve the policy, it was unanimous in terms of approving the resolution. So we have now those 5 strategic lines that you can see regarding the strengthen the governments and promote national policies and plans for HRH. Excuse me. Develop and consolidate regulatory mechanisms, strengthen the formation of interprofessional teams in the integrated health services networks based on primary health care, enhance workforce capacity building to address population health priorities and support emergency preparedness and response. And the last one, which it's something that really comes out of the pandemic, and we all felt it, we all felt the need, which is promote decent working conditions, protections of physical and mental of health workers, and adequate supply of HRH through financing and regulation. So those are the strategic lines. I also have to say that we're moving and really pushing this agenda to cover these strategic lines. Probably most of you are aware that tomorrow we're having a webinar on transforming the education of health professional careers by 2030, in which we will have a panel of national authorities. We have the Caribbean region represented by Minister of Health, Dr. Frank Anthony. We'll have the Vice Minister of Brazil, Isabela Cardoso. And also we will have a panel of experts in which, again, the Caribbean is very well represented by Dr. Wendy Seeley, who will be presenting the transformation of nursing education. We will have WONCA, which is the World Organization of Family Medicine, presenting the transformation of medical education. And we will have the president of the College of an association of schools of public health in North America, Dr. Laura Magaña, speaking about the transformation of public health professional education. So that's something that we're pushing. We're also pushing the development of interprofessional teams. And I also have to make an announcement that because we will have a big event called Alliance for Primary Health Care, which will happen in Uruguay, Montevideo, next December. And we have a panel and a workshop on HRH during that meeting that will be attended by heads of state, ministers of health, and experts from all the Americas. So that's what I wanted to report, Madam Chair, and I think we have a lot of opportunities to really strengthen human resources for health in the Caribbean as well as in the rest of the Americas. And having the commission is really something that is going to give us a lot of strength and opportunity to work around this issue. Thank you very much, and over to you.
Thank you very much, Dr. Puertas, for the update, and Ms. Bender also for the update on COSOD. It is good to hear that we have the ministers of health who have the interest in the issues surrounding HRH, and definitely it is important for all of us as members of the commission to keep advocating for HRH to be considered at the highest level, because that's the only way we can have impact as it relates to policy decisions and to address critical issues like the shortages and migration. So we will now proceed to the eighth item on the agenda, which is the report on the HRH IS system workshop in Panama. And so we would like to ask countries who were present. I believe Barbados was St. Kitts and Nevis, Montserrat, if they would give just a brief takeaway of what occurred and what they plan to proceed to do in their country as a result of this training that occurred for health information systems for HRH. So from the Belize perspective, this workshop was very beneficial for us in identifying the different challenges and also looking at the best practices that other member states have been undergoing as it relates to development of their HRH information systems, and how these systems tie within us being able to identify critical indicators for HRH management nationally, but also how our national system can support the reporting to other regional indicators that can also help us in Belize to address issues of HRH. Currently, Belize, we are implementing a HRH platform for management of our HR system. So our electronic system for HRH is has just been launched earlier this year. So we are just completing the population of this electronic system. And the objective of this system is to help us to be able to manage HR from an administrative point of view, but also to help us from a technical point of view for us to be able to obtain data and critical indicators for HR management. So that is our takeaway from that workshop, and also the importance of HR planning and HR data for the improvements of health systems and achievement of universal access and coverage. So thank you very much. We would like to ask Barbados if they could give a brief on their experience.
Good morning, sure. Just before I begin, for Belize, you just mentioned that you are looking at you said a electronic system you're implementing. I just was wondering, is it something you're doing unique? Is it something you're creating in country, or is it a software that you've gotten from, that is available beyond Belize? I'm just trying to find that out.
No, it's a locally developed platform that was done internal by our epidemiology and IT unit.
Okay.
And it is separate from our health information system that we use for clinical data. So it's a separate system, electronic system.
Okay, thanks.
You're welcome.
Yeah, so in terms of the workshop in Panama, yes, Barbados would have attended. I would have attended, and I would say that the workshop was very interesting, and it was good to see in terms of the presentations, the work that would have taken place in some of the other countries. For example, the occupational mapping exercises that have taken place. And for example, I think it was Jamaica, and the process for doing that. But beyond that, I would say for me, in terms of takeaway and for Barbados, I think St. Vincent, I think the CMO from St. Vincent, if I'm not correct, would have mentioned this point that we have, yes, we're looking at a human resources for health information system, but the challenge is that sometimes in most of our countries, we either have a human resources for health policy and plan that have they're either in draft, they've been completed, but they have not been implemented. And the point came across is that we need assistance in really getting our overarching human resources policies and strategies moving and up, so that would direct our information systems, because obviously the strategy and policy would give direction for what information systems as well we would want to utilize. I would have indicated, I think there was a session at the workshop where you would indicate what assistance your country would need. And for Barbados, we would have done a draft human resource policy and implementation plan back in 2018. I think it would have been through PAHO with the assistance, I think, of Dalhousie University, if my memory serves me correctly. And we have not gotten to the place of implementing that plan. So one of the items that we have asked for is assistance in being able to move those policy and plans to implementation stage. I know there was discussion about possibly internal in country, if you can get a guiding committee that can manage the whole implementation of the policy and plan. So that's an option, but we definitely need technical assistance in terms of how do we get these plans up and running and moving to the next stage. Another thing that came up was in terms of the maturity assessments that would have taken place, that there was the missing component of the assessment of information for human resources for health. And at the workshop, there was a presentation on a proposed tool that is being developed that we will be able to use, I guess, in the future to go in to do the assessment for information for human resources. So I'm not sure if I can get an update here on where we are with, or where, I'm not sure, can't remember the name of the person who did the presentation. I'm not sure if Benjamin can assist there, but how far are they in terms of finalizing that methodology or tool for us to be able to do an assessment, real assessment of our information systems as it relates to information on human resources for health? I'll stop here, but those were my initial takes from the workshop.
Thank you very much, Dr. Stacy, for your contribution. We'd like to ask St. Kitts and Nevis.
Hi, good morning, everybody. As the workshop in Panama was very informative, it created a backdrop for St. Kitts and Nevis to move forward in terms of improving its HRH. As part of that platform, we would like to introduce the HRH platform, as well as we would have requested technical assistance in terms of updating the HRH action plan, as well as engaging stakeholders to improve a mechanism to collect most of the NHA indicator data. Those are some of the areas which we think would assist us in improving our HRH in St. Kitts and Nevis.
Thank you very much, Ms. Krishma. Montserrat?
Hi, good morning. In terms of Montserrat, we were not able to attend that meeting. As a matter of fact, it's the first time I'm hearing about it. So I am not able to give any feedback, as I've just taken up the new position as Director of Nursing Services. I was able to attend the Regional Nursing Bodies meeting in July, but nothing since.
Okay, thank
So
you
I
very
look forward to listening to the other person's experiences and learning from it.
Thank you, CNO.
All right.
Montserrat, BVI, if you attended the meeting.
Good morning. No, I did not attend the meeting, and I'm not sure if anybody from the BVI attended either. I have not heard anything about it since.
Okay. Dominica, and then we will proceed to the next agenda item.
So I attended, this is Mrs. Raymond, SEO Ministry of Health. I attended and represented the Ministry of Health at that meeting. It was an eye-opener for me, coming in new as a focal point for serving the ministry. There are recommendations, and we look forward to the technical support, which we as well recommended in terms of technical support for training and also to build capacity to improve collection of data so that the data that is required can be inputted into the system. Thank you.
Sorry, thank you very much, Dominica, for that intervention. We have Miss Fiona has her hand up.
Yeah, thank you so much, Chair. Before we move to the next agenda item, Dr. Almeida, who was involved in the organization of the workshop in Panama, is online, and I think she would want to have some words. We can allow her, please.
Okay, sure. Kindly proceed, Dr. Almeida, with
Thank you very much. Thank
your
you,
intervention.
Fiona. Thank you, Ms. Bell. Thank you, Fiona. I'm sorry, I was looking for the little hand and I couldn't find. I was late into the meeting, and I'm sorry, there was a change of time here, and that's why I am a little bit delayed. Well, thank you very much for all the comments. Very interesting. We also, during the workshop, we collected information from the countries about the type of technical cooperation that they request. And I'm going to go over all the comments that were made, or the main ones. And regarding Ms. Goring, the support for HRH policy, and I am seeing here all the requests for technical cooperation. There are many countries that are requesting that from the English Caribbean countries. And perhaps I should update you that we had close to 90 participants from 37 countries. And yes, the BVI participated, and also Montserrat. And I can even give you the names of the participants if you're interested from those two islands. And but we have a pretty good presence of the Caribbean region there, and very active participation. And going back to the request for technical cooperation, I see here that in the request for technical cooperation, many countries in the Caribbean region has requested, as Ms. Goring said, support on establishing HRH, an HRH policy in which the development of human resources for health information system should be part of it. And also establishing the need to collect information on human resources for health. There was also evaluation of HRH information systems and development of an action plan. So they need, as also mentioned, they need to go back to the maturity systems methodology that we present. And to answer one of the questions, the methodology is finalized. It has been validated by many countries, so we have it ready. What we are doing now, it's working on a information tool that it's going to help you automate the results. So instead of doing everything in paper, we can do it just like the Is for Health EIH methodology that was applied in some of the Caribbean countries. We are able to map that in a tool that it's going to generate a report, and you can see the priorities and where the countries need to work on. But it is ready, and we should be able to apply soon. I would say in the beginning of next year, we should be able to do that. Another request for technical cooperation has been focused on training and capacity building of all stakeholders. As we emphasized during the workshop, there were a lot of information and regarding the need to involve all stakeholders, and also to make sure that we have support at the highest possible level. So the governance of information, data governance and information governance are the most important part, and that's what we need to focus on all the countries. And we also share the mapping of occupations, and there were also requests for technical cooperation, the mapping of occupation, and the National Health Workforce Account training. Let me see if I can share with you the name of those that participated from BVI, and there was another Montserrat, correct? I am looking for the names if you're interested, so you can, it would be nice to connect with those people and as a follow-up for the work that we've been doing. So for Montserrat was Miss Arlene Ponting. She is the Director of Secondary Healthcare Services. And for the British Virgin Islands was Miss Deidre Whitley Peters, Human Resources Manager at the BVI Health Services Authority. Just for your information, it would be ideal to follow up with them on the workshop Panama. And another thing that was discussed during the workshop in Panama, which I think it's extremely important for us to share here, we had a side event on the last measurement of the HRH plan of action. If you recall, our plan of action was supposed to end in 2023, this year. It started in 2017. and 2023 would be the last measurement and the last year of the plan of action. And the countries participated in 2 measurement exercises, one in 2018, the other one was a shorter version of the measurement during the pandemic, which was 2020. And now our governing bodies, PAHO governing bodies, requested that we do a final measurement now in 2023. And during that side event, we work with our focal points for health systems and services, so they could contact the countries and do the follow-up and the last measurement of the plan of action. And I would like to open the floor here for the possibility of adding that as one of the items in the agenda of the HRH Caribbean Commission, because it makes sense for us to work together on that. So we have the same people involved in all themes and all activity related to human resources for health. These are all complementary like activities. They all complement each other, and they can all support everything that we are moving forward with the agenda of the HRH Caribbean Commission. So I'll leave it here for questions, and if I miss anything, please let me know. Thank you.
Thank you very much, Dr. Amelaida, for that presentation and for giving us the summary of what occurred and the steps going forward as it relates to HRH Health Information Systems. We have a hand up. Kindly proceed, Dr. Partha Singh.
Good morning, Chair. Thank you so much for this space. Chair, I just want to pick up on the point that you made earlier about the confirmation of the persons to sit on as part of the commission from the countries. And I think, as Giselle would have shared, there really is the need for that cohesion of within country of different persons. There is no way one person can advance sufficiently what needs to be done when it comes to addressing HRH. It is a wider, larger team, and that team will cut across multiple sectors, multiple ministries, multiple areas of work. And while having one sort of focal at the commission is valuable, we do need someone to serve as that glue to pull all of this together. So I just wanted to reiterate that. And from my end, in the support to help with the countries to coordinate that kind of cohesion. Over.
Thank you for your comments, and definitely it is not a one-person initiative. Definitely it has to be collaboration within your ministry and outside your ministry with all the stakeholders. And one of the benefits of the workshop in Panama that I liked about that workshop, it gave us the opportunity to map our stakeholders. So mapping our stakeholders for HRH, who do we need to collaborate with, and at what level we need to collaborate with them, and how they can contribute towards HRH planning and policy development. So thank you very much for your presentation. If there is no other question in relation to the topic, then we can move to item number 9. Strengthening HRH in the Caribbean, a country experience. We have the Bahamas who will be doing that presentation.
Chair, if I may.
Sorry, Ms. Bender, please.
I believe the extended regrets they would not be able to do this presentation, and have requested that they seek to do so at the next meeting.
Okay, so item 9 and item 10 is going to be moved to the next meeting. And so we come to item 11, and there was no other business is to discuss at this point. So we'd like to ask Ms. Bender if she could assist us with the expected possible date for the next meeting.
Madam Chair, may I ask for perhaps if we could mention a workshop that's going to happen in Brazil on health labor market analysis. if I may just provide a brief information about this and the
Sure,
relevance to the Caribbean.
Sure, Dr. Portas, please proceed.
Thank you very much, Madam Chair. And I will ask also my colleague, Dr. Almeida, to provide any additional information. But remember that we had WHO, our colleague Juana Paola Bustamante, who is here, giving us telling us and talking to us about the framework of health labor market analysis and the interest it generated in the countries as a way to really have a much more comprehensive information on demand, on market, and many elements that are needed in order to have a better planning and forecasting of human resources for health in the Caribbean. So we are starting a series of workshops, one in each sub-region of PAHO, on this framework. So the first one is going to be in Brazil for South America next November 21st. We'll have the support from WHO and of course our colleagues from PAHO. In the next few months, we'll be organizing, and we will be having a similar workshop for the Caribbean. So this is to follow up with that positioning of this area that generated a lot of interest in some of the countries in the Caribbean. So the idea is to have the greatest participation we can achieve, and that's why. And I keep going back to the words of Ms. Bell about the importance of having those delegates confirmed. Because I think it's important that members of this commission participate in this type of events. But as you know, when we send invitations, we need to send them via our country offices and then to the ministers of health. And then we don't know how to follow up. That's why it's so important to have official delegates and the list updated, because we would like you to be there, because you are the people who are working on HRH, and we want to keep continuity. You heard what happened with BBI and Montserrat, that we need that connection on who is going and how is it going to benefit the countries. So this is going to happen again early next year. But I'm giving you the hint that this will be something that we are going to push very strongly in the region as part of the technical cooperation that PAHO provides to the region. That was, I don't know if Giselle, you want to add anything else, but thank you very much, Madam Chair.
Thank you, Dr. Puertas. Dr. Giselle, would you like to add to Dr. Puertas?
Sure. Thank you very much, Madam Chair, and thank you, Dr. Puertas. I just want to add that the importance of understanding the health labor market analysis to information systems and to the National Health Workforce Account, and how everything are interrelated. So you can see the continuity of the work and why we are working in all of these methodologies and tools to help the countries. So the National Health Workforce Account was formulated based on the framework of the health labor market analysis. So, and all the information that the countries collect in the National Health Workforce accounts are used in the health labor market analysis. So that's how these two are connected. Also, during the Panama workshop, we also did a little bit of exercise regarding the mapping of actors and the importance of understanding all the actors involved in HRH information. Because as I mentioned before, HRH information is very different. And that's why we now have a tool, a maturity assessment tool for HRH information systems, because it's very different from other information systems. We have to collect data from the health sector, from the educational sector, from the labor sector, from the finance sector, to understand the situation and to plan well for our human resources for health needs. We need all of this information. And the health labor market analysis give us this main picture of what are the actors, what we need to understand, and how we go about doing this analysis. So I just wanted to give you this introduction to the dynamics of the health labor market analysis and how the whole process of HRH information systems develop correlates to the National Health Workforce Accounts and the health labor market analysis. Thank you very much.
Thank you very much. I am not sure if it is a legacy hand or Dr. Parasingh has a comment or legacy hand. Go ahead.
It's a new hand, Chair. Thank you very
Okay, go ahead, please.
Just to add on to Giselle's intervention, the countries within the ECC and Barbados and the UK overseas territories would have received correspondence asking for a focal point to for this very set process in terms of the health workforce and even reviewing the plan of action on human resources for universal health, the last measurement. So this is also an opportunity on this forum to bring that to the table so that all participants are aware and can advocate for we've received feedback from only 2 countries so far. And so I just want to make a plug for the cohesive action for the focal points. Over, thank you.
Thank you. We have Professor Cummings.
No, good morning, everyone. I just wanted to know, I listened to all of the presentations. We shared the report from the workshop in Panama and the other presentation. Will they be shared with the meeting? Was I heard? Was I being heard?
Yes, Professor. You are requesting if the presentations from the workshop in Panama will be shared? Yes. Okay, Dr. Giselle.
Thank you. Thank you, Madam Chair, and thank you, Professor Cummins. I really appreciate the question because there is one thing that I forgot to mention about the workshop in Panama, and those of you who participated know that we have established a community of practice in the virtual campus for public health. And in that community of practice, you're going to find a space that was dedicated just for the Panama workshop. And in there, you are going to find all of the presentations from the experts, all of the reports, all of the methodologies, all of the material that it was presented. And as I promised, many of the attendants, the presentations that were not available either in Spanish or in English, they have all been translated. So you have everything available in English and Spanish. Okay, all you need to do is register to the community of practice. And I saw one email there. If you send me the emails in the chat, I can register you and you can see everything that it was shared during the workshop.
Thank you very much. Thank you.
You're very welcome.
So thank you all for your contributions today and for attending the meeting, and we look forward for your continued support and participation and engagement in the issues relating to HRH. Ms. Bender, can you kindly assist me with the tentative date for the next meeting?
Okay, Chair. So
Yes,
the next
please.
meeting would be in the first quarter of 2024. It would be for the meeting to decide if it's more convenient to have it in the earlier part, i.e. January or February, or if they'd like to have it in March. In any case, it would be the second Wednesday of any of the months.
Okay, thank you very much, Dr. Bender. I do not recommend January, as many persons would have been returning from the holidays and getting up to date with their activities in country. So it would be better in February or March.
Okay. Then I would leave it to the meeting to decide if
Okay.
February or March. In February, it would be if I see here correctly, the 14th, which is Valentine's Day. And in March, it would be one moment, the 13th, I believe.
All right, so we set the next meeting, if everyone is okay, with March 13th. February, we normally have the R&B, education and committee meeting normally in February,
Okay.
around those same dates. So the 13th of March is the tentative date for the next meeting.
Thank you, Chair. So we'll work with that guidance.
Yes. Thank you very much, Dr. Bender. And we now come to a close for this session. I see Dr. Puertas has his hand up. Dr. Puertas, please.
Thank you, Madam Chair.
ahead.
I just want to bring into the attention that at some point we will need to review the policy brief draft on migration of healthcare workers. Delegates will need to provide their input. Of course, by that time you will have sent already your input through the questionnaire, but still, you know, it's important for everybody to look at the policy brief with the policy actions, have any comments, changes, edits, so we can have a final document.
Okay.
Please advise me when is the next COSOT meeting, because by that time we would have to have ready that document to present to COSOT.
So normally this might depend. So we have a COSOT in September of every year, following or leading up to the PAHO meeting, right? However, we may have a special COSOT, and this is usually played by ear. So if the special COSOT is planned, we would let you know, and we would then have that. However, I would aim perhaps for the end of the first quarter, if that might be something that we could look at. So if the COSOT does happen, we can put it in then. But at this time, we don't have a special COSOT planned. But should that change, we would let you know.
Okay, thank you very much. So yeah, so that's good. Then we have some time to do the internal process within the commission.
Yes, and
thank you very much.
yes, thank you, Dr. Puertas. And I am sure that it is not going to be an issue if we need to have an ad hoc meeting to discuss and review the policy brief, because that is a very important document and very important activity that we need to ensure that member states can contribute and have their input. So if we need to have an ad hoc meeting, I am sure that Ms. Bender would be able to assist us, and Ms. Gita from CARICOM in organizing that ad hoc meeting.
For sure, Chair. It would just be for the commission to indicate
Yes.
same, and that is done commonly with other meetings. If it would be a special meeting for the review of the document.
Yes. Okay, so thank you very much. And we bring the meeting to a close at it's 9:30 Belize time, and I think 11:30 in the other Caribbean countries. So have a pleasant rest of your day, and thank you all very much for your time and contribution to this meeting and to the HRH Commission. So have a good afternoon. Bye-bye, everyone.
Goodbye.
Bye.
Thank you very much.
Bye. Have a good morning. Thank you.